Blake Schwank with CCS IT Pros, an IT services firm based out of Colorado. And what I wanted to chat about today it's not about the tech. We've talked about this before. Tech, the technicians, the technology is very important, but the rest of IT, the other 70% of healthcare IT that is critical is making the assessment of the workflow and what your staff are trying to do. And this is the business side of it. It's sitting down with the nursing staff. It's sitting down with the finance staff and trying to figure out how they use technology and how we can help them implement it better. And what really sticks out to me is we have a hospital where when we were going through and working on faxes, now faxes are still around. They're being used more than ever. And I saw one study where faxing is actually increasing in healthcare. And I was at HIMSS last year. It's a large healthcare IT conference. And I was talking to one of the vendors, and we have a bet that in 2034, 10 years from now, one of us is gonna owe the other a drink if we're still using faxes or not. And I bet that we're still gonna be using faxes in 2034. But I bring this up because we have this hospital when we were troubleshooting an instance of a faxing problem. They were trying to fax to a doctor from the lab, and the doctor wasn't getting the fax. Now, if you just assign this to a tech, and they're going to go out and do exactly what they're asked, and they're going to do a great job of it. But this made it to us to assess, how this workflow is happening. And it turned out that believe it or not, I originally thought that they were sending it to a doctor across town. They were in the lab, printing out a order and faxing it to the physician. The physician's office printed it out and then dealt with the form and then scanned it back in. And it turned out that this physician was down the hallway from the lab. And as you know, there are lots of other ways to securely send documents within the same practice, the same building, the same network, where you've got IT security, all the cybersecurity stuff built in, that they could have shared this much easier without printing it out, without faxing it and everything else. And an IT guy would have just gone and fixed the fax, done their job great. But the assessment, the business side of it is, how are they doing this? They're wasting hours and hours of time, probably, every week, faxing within the same hospital. So that's where the business side of IT comes in, is making those assessments on how your staff actually use the tools that they have, and are there smarter ways to use technology to do digital transformation within your hospital, within your medical practice. And this is especially true out in rural hospitals, rural health. If you're in Denver, if you're in Chicago, you have a lot more people coming in from large organizations where they're already doing these things. At a large hospital with thousands or tens of thousands of employees, they're already doing these things the proper way. You get out into rural health, rural hospitals, critical access hospitals, not so much, because they don't have that influx of people that have different ideas. That's when it's really critical to have an IT team to work with you to figure out how to better run your operation. If you need help trying to figure out how to run your hospital, your rural hospital better, give us a call at CCS IT Pros. We're experts at this, and we can help you run your business better. You can find us on the web at www.ccsitpros.com or call us at 719-439-0599. I look forward to talking to you.